give her access, Alex.
Okay, go ahead and try sharing your screen now.
Okay, let me try that here. Is that showing there?
Great, yes, it is.
All right. Okay, let me, still okay there?
This is so exciting.
Perfect, yeah.
Yes.
Okay, cool. I'm excited. Thank you so much for allowing me to be here. Thank you, Brianna, for the invitation. So fun little story, Brianna and I were both undergraduates around the same time, which seems like a long time ago, or it seems not so long ago, but it seems that it was quite a few years ago now. But I'm excited to be back in El Paso, and today I'll be talking about substance abuse and oral health. So a little bit about me. I did do my undergraduate at UTIP. I graduated in 2014. I went to dental school in Houston at the UT School of Dentistry and graduated in 2018. I stayed around for another year and did an advanced education in general dentistry residency. So pretty much what that was an extra year of schooling and kind of more hands-on general dentistry work. I am going back to school this summer. I'm going to school at AT Still University to get an MPH and dental public health degree. What that means is that after I complete that program, I will hopefully have the opportunity to take a board exam to become a board certified dental public health dentist. I currently work at La Clínica de Familia in Chaparral, New Mexico, which is about 45 minutes away from where I live on the east side. And I recently become the dental director there. And so this is a public health facility. All are welcome. We do reduced cost dentistry, but high quality dentistry, of course. But if you are somebody or you know somebody who has a low income, we're able to provide care to anyone who walks through the door. And we work off of a sliding scale. So we base it off of your income. Whatever your income may be, we offer you a discount based on that. And I also serve as a consultant for the Woody L. Hunt School of Dental Medicine, which is the dental school that'll be opening up in town this summer. So really exciting. If you are interested in dental school, this will be a great school for you to attend. But Houston is also a great school as well too. So if you have any questions on dental school and what that's like, I'd be glad to answer any of those. So here's a little bit of an outline of what I'd like to review today. So I'd first like to review some oral hygiene, then go through different substances that can be abused and what their presentation is within the realm of dentistry and how it presents in the oral health, and what we can do to prevent and treatment for these patients who come into the doors of the dental practice. You'll see that many of these presentations are very similar. And so some of the treatments are really similar as well too. Yeah, let's go ahead and get started. So really important that we start off with kind of the basis, which is reviewing oral hygiene. And oral hygiene is really important for anyone, whether you're a substance abuser or not. But it's truly important to brush your teeth twice a day for 2 minutes with a soft toothbrush, and make sure it's soft. I know some people like a medium or a hard, but you really want to try and aim to use a soft toothbrush because anything harder can cause abrasion around your teeth and on your gums. And it's absolutely essential that you try and brush twice a day, but if you can't, you should aim to brush at least once a day in the evening. I know a lot of people think, I wake up in the morning, I want to get my day started fresh with a fresh breath, so I don't breathe into people's faces and they can smell it all. So I try and brush in the morning. Well, while that's important, you really want to try and brush in the evening so that way you're eliminating any of that bacteria that's present before you go to sleep. At night, our mouth tends to dry out quite a bit, and bacteria really thrive in that dry environment. That's when they start to make cavities. It's really important to remember to change your toothbrush out every 3 months or sooner. You want to do it sooner if you have become sick or if the bristles have become frayed on your toothbrush. You want to make sure you're using a fluoride toothpaste. I would recommend that you stay away from charcoal toothpaste. Those are a little bit too aggressive. Flossing at least once a day. And I recommend using a mouth rinse that's non-acidic. While Listerine feels great and you may like that burn, if you are a high caries risk patient, that actually might be detrimental because it's too acidic. So you want to use a non-acidic mouth rinse, and Act Fluoride Rinse is a really great mouth rinse to use. You want to reduce your snacking and sugary foods, reduce your soda consumption. If you do choose to drink a soda, you want to make sure you drink it in one sitting. So if you're having a soda for lunch, you want to make sure you finish it within that, say, hour that you have for lunch. You don't want to start drinking it at lunch and then finish it at 5 p.m. because you're constantly exposing your teeth to that acid and that sugar. So some people think, you know, I'm only having one soda a day, but if you prolong it throughout the whole day, you're really causing more damage than if you were to have it in one sitting. And you want to make sure you're visiting your dentist at least every 6 months. I know sometimes with insurance it can be difficult and you can only go by once a year. And some patients need to be seen maybe even sooner than that. So some patients, if they are a perio patient, meaning that they need deep cleanings, may need to be seen sooner, like every 3 months. So I will have some, maybe some gory pictures that maybe some of y'all will be a little uncomfortable seeing. But it truly is the presentation of what we see substance abusers come in with, and kind of our foundation of where we start with. So I do apologize if you become uncomfortable. I am a little desensitized to this, but just bear with me and I think you'll find it really interesting. So one of the biggest presentations I would say of substance abuse is with methamphetamine. This is a very common presentation of meth mouth. So meth is considered to be very addicting, but it's also very acidic. So we talked about that mouth rinse being too acidic. If it is too acidic, you can wear down your enamel and your dentin. Your enamel and your dentin are your first two layers of your teeth. So if you wear down the enamel, which is the white part of your tooth, you'll go into the next layer, which is dentin, which is the more yellowish part. And that is a lot more sensitive to hot, cold, sweet. So you really want to make sure that you are protecting your teeth at all costs, especially the enamel. You'll start to get decay on the buccal, cervical, and interproximal. And what that means is pretty much the face of the tooth, and in between the teeth is where you'll start to get cavities. You'll see that you'll start to see gum disease, periodontitis. And so you can see how the gums on this patient, they're very red. And all this kind of plaque and debris that's around these teeth are causing this inflammation. But not only is it damaging the teeth and the gums, it's also starting to damage the bone underneath. So the bacteria will start to eat up at the teeth and the bone, and you'll start to get bone loss, and that leads to gum disease. You can have vomiting. So that vomit that comes out has that increased acid. And again, that acid can wear down your teeth. Methamphetamines can cause anxiety. And because of that anxiety, you will clench and grind your teeth, which increases the wear to your teeth that you'll have. And you can also have dry mouth xerostomia. And again, that dry mouth you really don't want to have because you're not able to wipe away that bacteria in your mouth. So your saliva acts as a buffering agent, and it helps reduce the acidity that's in your mouth from whatever it may be, whether it's a food product that you've eaten, soda. But again, here, if you have acid in your mouth from the methamphetamine and you have dry mouth, you're only exposing your teeth to more of an issue. Here's another picture of a methamphetamine user, and also here on the other side, we have a picture here of the mouth of a diet soda abuser. And pretty much any soda abuser, you will see something along this lines here. So you will see patients that sometimes come in with this presentation, and you will kind of pry into them and really try and see what happened. You want to know if this is a drug user or a previous drug abuser who's coming in, just to see how you can best approach their care and their treatment. So I remember I recently had a patient come in, and he had this presentation, and I was really trying to get to see what the bottom line was, why he was coming in like this. He was an ex-military member, and he said that he hadn't had any problems with drug abuse. He hadn't been addicted to any medications. And so I thought to myself, and I looked at him, and I said, "Are you a drinker of Mountain Dew?" And he replied, "Oh yeah, I love that stuff. I drink it every day." So Mountain Dew is super, super sugary, super, super acidic. Please don't drink it. It's really terrible. It can tear up your teeth. And you will see a lot of presentations of patients who come in who are soda drinkers, but with more emphasis to Mountain Dew, come in with this presentation. So if you have children, siblings, younger siblings as well, I would really encourage you to take this drink away from them, because it can also cause an issue with young children as well. You'll see a lot of decay and rampant decay in young children, which can be an issue. The next drug will be ecstasy. Ecstasy also causes a lot of anxiety, which you'll see bruxism, which is that tooth grinding. So this isn't necessarily a picture of somebody who has taken ecstasy, but it is somebody who bruxes their teeth, so grinds their teeth. And you can see that they're completely worn down. And so if you have somebody who isn't a drug user who has this kind of wear, you really want to find out what is happening that's causing this wear. It can be a lot of reasons. It can be anxiety, stress. It can be an airway issue. A lot of times we see that if patients can't breathe at night or they're snoring and have sleep apnea, they'll grind their teeth to compensate, to kind of open that airway in the back to allow air to go in. But this is a drug presentation, so we know that ecstasy increases that anxiety, which may increase that bruxism and clenching that patients are doing. Because they're clenching so much and grinding, it's almost like going to the gym and overactivating your muscles or doing the same kind of rep over and over again. When you're clenching and grinding, you are using the muscles of your face and your jaw. So you can have some pain and tenderness in those jaw muscles, and it can radiate all the way up into basically around your skull, because the muscles go all the way up there. So you can have some migraine, some tenderness, and it can be truly painful for patients. You can get trismus, again, because that muscle is constantly in activation. Trismus is some difficulty with opening your mouth. Dry mouth you'll see is pretty much an issue with all the substances that we'll cover today. And you might even have some mucosal involvement like ulcers, edema, and necrosis. Sometimes if these are ecstasy pills and they put it around their gums, these pills will tend to start to erode or start to eat away at some of the gum tissue. So it can be really dangerous. And truly what happens is that the gum tissue will start to dissolve and you'll start to see the bone present itself from underneath. Cocaine, yeah, this is a hard one. It's a hard picture to see even for myself. But we know cocaine, if patients are snorting cocaine, they can cause a nasal septum perforation, but that perforation can connect all the way down to your palate. So you can have a palatal perforation as well too. You can also have the ulceration of gum and bone from rubbing cocaine over your gum. So you'll see, or maybe you've seen the movies where patients or people will snort their cocaine and then they'll put a little over their teeth. When they do that, they're causing that direct contact between the cocaine and their gums and their teeth. So it can cause some issues there. In the same way of ecstasy, if you have cocaine start to eat up at the gums, you can have some of that bone start to expose itself as well. Because it is a little abrasive, if you're putting it on your teeth, you can have enamel erosion. So that cocaine can start to kind of be abrasive or erode at the enamel. Dry mouth, like we mentioned, bruxism. And cocaine is also a vasoconstrictor. So it can be really dangerous if a dental patient comes into your chair, into your office, and you want to do a procedure on them and you don't recognize the signs that they've previously used cocaine, and you use a local anesthetic to anesthetize them. Since it is also a vasoconstrictor, you can increase their blood pressure, which is an issue because you can essentially cause a heart attack in your chair. So you want to make sure that you have a conversation with your patient when they first come into the office to see if they are a drug user, what drug that is, and really encourage them not to consume any of these products before they come into your office. And if you have somebody who has come in and has had cocaine, and you give them lidocaine, which is a local anesthetic to anesthetize the patient, you can increase the risk of convulsions. Heroin. So heroin, you can have increased cravings for sweet foods, which can lead to decay, dry mouth, bruxism, discoloration of your tongue, and increased incidence of gingival and periodontal disease. So here we can see some presence very similar to meth mouth, where we have plaque kind of here at the cervical areas. You can see that it's really traumatizing the gums around the teeth. And you can see that the gums are really high up. And even down here, they're a little bit lower. They really should probably be here at this level. I hope you can see my cursor. Same thing here. And you can see that it's receded quite a bit. I would suspect that if I were to do an exam on this patient or even clean this patient up with a cleaning, that their teeth would start to get a little bit mobile. So this patient is probably going down the track of having a full denture completed. But you can see that this is a 36-year-old patient who injected heroin for over 8 years. Opioids is another addiction that we see in patients. You can have dry mouth, burning mouth syndrome, which can be really painful, just things burn. Things can cause a lot of pain as well too. Even simple foods or toothpaste can cause burning in your mouth. You can get taste impairment, bruxism again, increased risk of gingival and periodontal disease, acid reflux. So acid reflux is very similar to vomiting because if you have that acid presence in your mouth, again, you can have issues with it disintegrating your enamel and your dentin. You can have increased risk for ulcers and sores. But the big thing with opioids is that you can have masked pain. Depending on the level of addiction that you have in an opioid patient, if they are taking large amounts of opioids, they may be taking enough that they don't recognize that they have pain in their teeth. So they may have issues with their teeth or pain or teeth that are kind of bombed out that need treatment. But because they're taking these medications, they're not acknowledging that they need this care, which can be truly dangerous because the day that they stop these opioids, they will be in extreme pain. And what you'll see is that with opioid patient, it can be kind of difficult to manage their pain after you complete whatever dental work that might be done, need to be done. Marijuana. So marijuana, since it is a carcinogen, can increase your risk for oral cancer, dry mouth again, increased incidence of gingival and periodontal disease. You can have vomiting, which is that increased acid presence in your mouth. And those increased cravings for sweet and fatty foods, which can lead to decay. So the big thing I would say with marijuana is since it is a carcinogen, you can have a lot of issues that lead down to the route of oral cancer, which can be really scary. So you can see here, you can have that staining around your teeth that's a little bit darker that you would see from smokers. And again, you have that periodontitis, that gingival, reduction that you see around the teeth. Tobacco. So I stayed away from a tooth picture here and wanted to give you a picture of a tongue that almost looks like it has hair growing on it, which I know can be a little gross, but really important to also brush your tongue. Put that into your daily habits. But with tobacco, you can have an increased incidence of gingival and periodontal disease. Huge risk for cancers, including oral cancers. Throat cancer is huge as well. Halitosis, bad breath, staining of teeth in your tongue. And black hairy tongue, which is what we see here in this picture, which is pretty much just raised projections of your taste buds. The way you get rid of that is pretty much the oral hygiene and stopping the tobacco, but using a tongue scraper can be really a huge advantage. With this hairy tongue, you'll find that many patients will say that they can't taste anything or they have a thick kind of biofilm feeling on their tongue. So really important to educate your patients if they are tobacco smokers how to have that correct oral hygiene, and also encourage them to see if they would like to have any smoking cessation treatment or guidance. Smokeless tobacco is also very dangerous as well. It can cause halitosis, bad breath, risk for oral cancer, also an increased risk for cancer of the larynx and the esophagus. Periodontal and gingival diseases, also an increased risk. There are also some sugars or some flavorings that can be found in smokeless tobacco. So you're putting basically sugar right up against your teeth, which can be dangerous because it is a sugar and it can dissolve at your teeth or start working at your teeth. And the products can be very gritty and abrasive. So here you'll see that this is kind of where you start seeing this wear of the teeth that isn't not actually the whole tooth, but just kind of the areas at the bottom where the gums are. Pretty much this is happening because the smokeless tobacco, chances are they're putting it here in this area, and it's rubbing against the teeth and starting to wear down at the enamel and the dentin. So chances are this patient doesn't have any pain. Teeth can be really funny. Sometimes when you expect pain, you don't see that pain, but chances are these teeth have become necrotic or dead, and this patient may not have a whole lot of pain. They might, but I would be really surprised. Sometimes when you start to see this brown around where the area where you expect the pulp to be, sometimes they don't experience any pain. So in this case, you could try and place fillings on these teeth just to see if you could protect them and get a little bit more life out of these teeth, or you may need to extract them and give them a little partial denture there. Or you could put some crowns over them as well. Alcohol is another area of addiction that we can see amongst patients. So most alcohols can be acidic, which can lead to erosion. Dry mouth is here again. You can have increased risk for injury, especially patients who consume large amounts of alcohol. You never know if they'll go get into a fight, and sometimes you'll have patients walk in who may have had a little brawl on the weekend previously and may have lost a tooth or so. It is the second most common risk factor for oral cancer, according to the CDC. You can have stained teeth, especially with darker alcohols, especially beers that have malt in them. The patients who are alcoholics tend to have higher plaque levels. You can have vomiting if you consume too much alcohol, which can increase the acid in your mouth. And you can have increased cravings for sweet and fatty foods, which can lead to decay. So it is really important that if you are a casual alcohol drinker, that you really focus on your OHI, on your cleaning of your teeth. And if you do have an episode where you vomit, you want to make sure that you are at least cleaning your teeth right away with a napkin or some kind of towel to help eliminate some of the acids that's there, and wait 30 minutes before you brush your teeth. I know that you have that feeling in your mouth that sometimes can be uncomfortable after you do vomit, but you want to make sure that you are not spreading all that acid around your mouth. So 30 minutes gives enough time for your saliva to kind of buffer that acid that's present, and kind of calm things down a little bit before you can go in there and brush with a fluoride toothpaste to kind of calm things down a little bit more. I'd like to talk about prevention and treatment. Well, prevention is key. We really want to try and help patients who haven't, gone down the road of addiction to not go down that road. So if you have, a casual user, a light user, you want to make sure that if they're able to get treatment or rehabilitation ahead of time before they go down, that route that might be an addiction, that we guide them in order to do so. And treatment, you really want to be just supportive of whatever process or whatever stage in life they might be in. You really want to take away the cause of the issue. So if you can help substance abuse patients with that substance abuse, that would be really key. And typically it's not the dentist that helps them. You can send to a behavioral specialist or the appropriate people to help the patients, or through the physician to connect them with somebody else, just so that way they can get maybe into a rehab program that would be best suited for them. Emphasis on that oral hygiene instruction. You come to see that many patients who come in with this kind of presentation, they are just not knowledgeable of the importance of oral hygiene, and they're not understanding of what they need to do. So you kind of have to start from square one with them: how to brush, how to floss. You may want to prescribe a special sodium fluoride toothpaste, which is just a toothpaste that has increased fluoride levels, which is just allows you to kind of increase the strength of the teeth. You may want to think about doing fluoride trays, which are basically trays that you would use to place fluoride inside, where the patient would bite down and maybe wear them overnight or for a few minutes throughout the day. It just increased fluoride to the teeth. You want to check their periodiagnosis and treatment. So the way that we do that is we use a probe. And this is where everyone says that when they go to the dentist, we stick them with an instrument, which is not true. But we do use a probe to feel around the teeth to see where the bone level is. And if it's deep enough, you may need a scaling and root planing. And that allows us to anesthetize the area and really get down to the depth of where the pocket is and eliminate all the plaque, bacteria, and calculus that have built up over time. Being able to do that, that's really your foundation. Cleaning all of that up, you can clean all that debris out, and you have a strong foundation to kind of move forward. From there, chances are you'll have to do quite a few extractions, restorations, including fillings, crown, and bridge work, dentures, and removable partial dentures. So dentures are for where you remove all the teeth and you give them a prosthesis. And removable partial dentures are where you keep some of the teeth and you give them a prosthesis that only replaces some of their teeth. And of course, you really just want to be a source of encouragement and support to the patient, because you really don't know what the future brings for them. They may relapse along the way. And especially with a denture patient, you'll see them quite a bit. So you want to make sure that you're there for them and you're supportive of them just down that road of rehabilitation and down that road of using a new denture if that's their individual case. So this patient here, I don't have a before picture. This is a case I kind of adopted, but she was a drug user and we had to extract all of her top teeth and the majority of her bottom teeth. And it was a very emotional treatment and process for her, but she was a trooper. She shared her story with me along the way, and she has made a lot of changes for the good in her life, which is really exciting for her. and we gave her a denture, which I was really excited about, and she was as well too. And on the bottom, a removable partial denture. And so you can see here that she was really happy, and she told me her response when she came to see me after we delivered the denture was, "I can eat Takis now," which is a great compliment to the work that we both got to do together. These are some of the works cited that I cited throughout the PowerPoint here today. And this is my information. If anyone has any questions or is interested in the field of dentistry, I'd be glad to answer them for you. If you want to catch me on the gram, that's my handle. And I did see there are a few notifications on the chat that came through, so I'll see if there's any questions I can answer, but I'd be glad to take any questions that you all have as well.
I also went ahead and made the muting thing available to everyone. So if anyone has a question, they can jump on mic.
So Carla had a question in the chat, and then we'll go to Shiva. So she asks, when there is damage like those seen in alcohol, can they be recovered, or will they have to be extracted and replaced?
It really depends. So the big thing with alcohol is that you'll see a huge acid consumption of the teeth. So if they're worn down enough, they may need to be extracted. But if they're at the level that maybe you can repair them, maybe do some restorations or crown and bridge work, you may be able to do that. But the big thing here is if they are an alcoholic, you really want to make sure that you're removing the stimulus, because if they continue to consume this alcohol at the same amount and the same rate, whatever work you put in their mouth will just end up failing again.
Go ahead, Shiva.
Yeah, I'm just curious. Is there any correlation between like anxiousness or being panic and bad breath? Like, I feel like sometimes when I feel anxious and like when I'm panicked, I can feel like my breath is bad. So do you know, is there any correlation between those things?
Yeah, sometimes what you'll see if somebody's anxious or nervous is that their mouth will go dry. So sometimes public speaking may not be something for everyone, but they'll feel that their mouth goes dry, and that dry mouth will cause that bad breath because you don't have that lubrication from the saliva there. So you really want to make sure that if you have that dry mouth, you're lubricating it with water, or if you have consistent dry mouth, that you use some kind of saliva a replacement product.
Oh, I see. Okay. Thank you.
But yes, basically the bad breath is coming from the dry mouth.
I see. Okay.
Sorry. Go ahead, Richard.
Okay, so a couple questions. The first is like, in terms of enamel, is there any way, like, I know you're talking about the layers of enamel. Is there any way to like regain enamel, or is it like once it's lost, it's done? And the second, to rewind all that, amazing talk. That was really, really interesting. That was super interesting. But yeah, that was my first question. The second one, straight from the dentist's mouth. If you were to go to your bathroom right now, what toothpaste are you using and what toothbrush are you using?
Great questions. I appreciate you enjoying the presentation. I hope it wasn't too gory for you all. But the first question, as far as regaining enamel, really hard. I know that there are some researchers doing research on this, but if you have lost it to the point where your dentin is exposed, there's no way for you to regain that enamel again. So pretty much what you have to do, what you're left with is basically either having restorations placed on your teeth or just maintaining your teeth with that dentin exposed to the best ability, possible. You may need to use products like Sensodyne, which is a sensitivity toothpaste that helps just desensitize your teeth a little bit. Once that dentin is exposed, you're just a lot more prone to being sensitive to colds, to sweets, et cetera, along those lines. If it's worn down a little bit, you can't really regain it, but you can help strengthen it. Toothpaste help, especially, extra strength fluoride toothpaste, but you really can't regain it. So you're pretty much just you're off just kind of protecting whatever you have left. What toothbrush and toothpaste I'm using. So I use a Sonicare. I do like electric toothbrushes. So Sonicare does a side-to-side kind of vibration. Although there are studies that Oral-B, which is a rotating, oscillating toothbrush head, is a little bit better. But I think that it's truly patient's preference as to what they like. And toothpaste, I am not super picky with my toothpaste. I'll be honest. So I think right now the one that I'm using is a Colgate. They have a new Total Care. It's a gray tube. That's really good, and it has a stannous fluoride in it, which is really good as well too. Although too much stannous fluoride isn't good. So too much of anything, as we know, is not great. So too much fluoride can cause some issues with your teeth as well too. But everything within appropriate limits is great. But whenever I give a recommendation for a patient as far as toothpaste go, I tell them to go bottom shelf. You can't go wrong with whatever the basic Crest Colgate is on the bottom shelf. Everything else on top is just a little bit more heavily marketed and a little bit more costly, but you're really well off with just whatever fluoride is present in those bottom shelf toothpaste.
So Alex asked, is baking soda beneficial? Is it a valid selling point for toothpaste?
Yeah, so I think the big thing with baking soda is they probably sell it as a whitening product, and I have issues with products that have baking soda or charcoal because truly what it is, it's just being abrasive. So think of it as small little sponges kind of scratching at your teeth. And what they're doing is they're just making it a little bit whiter, but because they're scratching at them. So I don't really like patients using baking soda directly. I think that if it's in a toothpaste, it's probably regulated a little bit better, but charcoal toothpaste, definitely stay away from that.
Does anybody else have some questions? And that was an awesome presentation, Tanya.
Thanks.
Go ahead, Richard. Sorry.
Sorry. I can talk all day about this. This is like all this stuff is super interesting. Okay, so you described about like different, like obviously like meth and everything like that are bad for teeth. Are there any foods or like outside of just like drinking water that are actually beneficial for teeth? Is there such a thing as that, or is everything we just bad?
No, I would say that, you know, if you're a snacker and you want to do snacks, or if you have children and they want to do snacks, you want to do healthier items. Carrots are great. There are studies that, you know, back in the day, people used to use carrots to help clean their teeth because, you know, just biting into a carrot, kind of that motion kind of cleans down your teeth. So carrots are really good. We recommend carrots. Nuts are good as well too to consume. Of course, you know, you don't want to get those sugar covered nuts because those are probably not that great for you, even though they're the best tasting ones. You know, water is really your best liquid that you can consume. Tap water is great if you're in an area where tap water is safe, because most states have programs where they fluoridate your water. So you're getting fluoride directly from your water source. So we really encourage, you know, children to drink tap water because they're getting that extra source of fluoride. Also, if you have children, another huge thing, never put your child down with a bottle of milk. Early childhood caries is super, it's a big deal. And one of the big causes of that is putting children down with a bottle of milk because they're constantly being exposed to that milk to their teeth. And if they're not getting them cleaned after, you can cause some cavities right in the front. So you'll see a lot of children have those silver teeth on their front teeth. Coffee and tea are good. They can stain. That's probably the biggest complaint of most coffee and tea drinkers. If you decide to go the whitening route, you'll want to make sure that you drink your coffee and your tea with a straw, also with wine.
Any other questions? Yeah, just like Richard said, that was really impressive. Like that was interesting because we usually study the brain, but when you put it like in a different perspective like this, I feel like I learned a lot.
Yeah, I guess I could have made some more correlations with the neuroscience behind it, but I feel like you all
No,
probably
I'm sure you
understand.
could.
I'm probably you all understand that a little bit better than I do, but the effects that kind of it just produce that these drugs produce is pretty insane. The dry mouth being, you know, one of the you see dry mouth and bruxism almost in all of them, and the cavities that are right on the front of those teeth is really severe most of the time when patients come in. Most of the time, you'll see patients come in when they're ready to make a change in their life, especially if they're an opioid patient. They'll usually come in when they're having pain. And that's usually when you'll first see your patients too, is when they're having pain, will be their first presentation. And you do whatever you can to really convince them to try and make that change, because wearing a denture is not fun. I'm excited that you all thought that was interesting. Most people are either really grossed out by teeth or not interested with teeth at all, but this is something that I feel very passionate about. And being in public health allows me to have the opportunity to serve patients who maybe not had the opportunity to receive care in the past. So it's really nice and really rewarding when you get to see patients who come in, whether they're substance abuse patients or not, and you know, help them make a change in their life.
Yeah, all the stuff that you do for the community, that's amazing. Like you're really busy. Um, we appreciate that, and we appreciate you coming by and sharing all this. It was very like I was very, what can I say? Intriguing.
Sure, hopefully a little eye-opening as well too. I wish we could have been in person,
Yeah.
but maybe another time.
hmm But thank you so much. Anybody else? Any other questions? All right. It looks like we're good. Thank you so much.
Thank you all. I
We're gonna
appreciate it.
post this. Yeah, everyone is saying thank you. We're gonna put this on YouTube, so Alex, you can turn it off now.
Okay.